Welcome to another episode of the Beyond the Device podcast, where we explore the life-defining moments that shape careers within the medical device industry. We're particularly interested in understanding how personal experiences, challenges, or pivotal events influence professional journeys. As we progress through the conversation, we will eventually land on the question, what is the one defining moment or experience in your life that changed everything and set you on the path you're on today? Our guest today needs no introduction, but I'll give it a go. She has almost 40 years of experience in the industry and is widely recognised as a leading expert in IVD regulations. Her impressive career spans senior roles in industry and across 3 different notified bodies, including helping establish BSI as an IVD notified body and chairing EU working groups. She is now the founder and principal consultant of Compliance Connections, where she supports companies navigating the complex regulatory landscape in the EU and the UK. We personally met over 10 years ago at the BIVDA regulatory working parties, where I quickly realised the reputation she had in the industry. So it's a privilege to welcome someone with such deep-rooted experience onto the podcast to discuss her journey. So without further ado, I'd like to introduce Sue Spencer. Welcome to Beyond the Device, Sue. How you doing?
Great, thank you. And thank you for inviting me.
It's good to have you on.
Right, so let's roll this all the way back to the beginning, Sue. Where did your story begin? Can you tell us about your earlier years and kind of what shaped you growing up?
So I'm a Yorkshire lass. So I grew up in the Yorkshire Dales. Both my parents were family doctors. And so the surgery was actually beneath the house. So I have grown up listening to medical talk all day across the breakfast table. And it also meant that from an early age, I kind of had that interest in kind of healthcare and caring for people. It's also, and I have to preface this by saying different times because this would not be allowed now, but because they were family doctors, we had a local district hospital, which meant that they would go every day into the hospital to see patients, talk to consultant secretaries, but also to drop samples off at the pathology lab. So as I got a bit older, that was always my job in the summer holidays, was to go with them, take the samples to the path lab. And sometimes there might be an interesting result and they'd want to discuss it with the guys in the lab. So I kind of was privy to those discussions. So that was my very first sort of foray into, IVDs, as it were, and it started to kind of spark a little bit of an interest in that area. So I think initially I always kind of wanted to be a doctor, and it was almost always expected. Unfortunately, I was also born with a birth defect. So I had a congenitally dislocated hip, and my leg was 2 inches shorter than my right. And by the time I got to 16, it pretty much wore out. So this meant that really being a doctor perhaps wasn't going to be the best career choice moving forwards. It also meant that studying was quite hard because I was in an awful lot of pain. So it meant that I dropped one of my A-level grades. And so I think one of my bosses at one point said, Sue, that's not career planning. That's a whole lot of happy accidents. And so my first kind of happy accident was the fact that I dropped a grade. So I should have gone to Leeds University to do microbiology. And I ended up going to what in my day was Hatfield Polytechnic. It's now the University of Hertfordshire, because it was one of the only 2 places in the country that at the time did a sandwich degree. So I did a year out in industry. And my year out in industry was at St Albans City Hospital working in the immunoassay lab. So again, that was kind of my second introduction to immunoassays. And I was evaluating what was one of the first high sensitivity TSH assays at the time. And I really kind of got the bug at that point. And when I went back and did my final year, it was kind of like okay, I now know where I want to go, which is I think really difficult for people who perhaps at school my teachers knew about medicine, but science was kind of something you taught or was academic. And I think one of the issues we have in the devices industry and the manufacturing industry is actually people who influence people at that early age don't even know it existed. If I knew it existed and I knew what it was about, I'd have known what I wanted to do earlier. And I only found out because I had this happy accident and ended up doing a sandwich degree, which allowed me to actually experience what it was. And so certainly with my elder son, who's actually also gone into regulatory, I did try and get him some work experience because actually working in a lab is not for everybody. And so it's difficult to get that experience at the time when you're making those career decisions.
Yeah. And on that point, when Duncan and I joined the recruitment industry, we didn't actually know what we were getting into. We were just told we would do recruitment, and we were fortunate enough to be put on to medical devices. We didn't know what it was. I think we were told it was like a scalpel or an implant or something. We were like, oh, that sounds cool. We could have been in IT recruitment, but that's where we ended up. And
Thank God.
actually, from speaking to most people, they didn't, who are in the industry and working similar to you, they didn't have a clue it existed until they sort of fell upon it. So apart from obviously the influence of your parents, were there any other sort of key role models or influences in your early life sort of guided you to where you are now?
Well, I think perhaps one of the people I would think about was when I first joined LRQA as my first notified body I worked for. So again, another happy accident was I was on holiday. We knew the startup company I was working for was going into liquidation, or we thought it would. Got back, my redundancy notice is on the doormat. But fortunately, one of my friends from university had set up a recruitment organisation. So I had a message on the answer phone saying, you've got an interview on Monday with this company called LRQA. They're looking for this really odd mixture. They're looking for people who know IVDs, have audited, and they've heard of this thing called the IVD directive. Now, at the time, the IVD directive hadn't actually even been published. It was still in negotiation. So I went for the interview on the Monday. They wanted me to start on the Tuesday. We settled for starting on the Wednesday. So actually, that really was the point that I kind of moved into the notified body side. But I worked for a lady there, Pauline Hilton, and she wasn't a technical expert at all, but she was very good at analysing and looking at problems. And not only that, but how to clearly communicate the issue to customers. So it's not, I'm telling you you can't do this. It's okay, let's go back to the requirement. Let's explain the requirement. And then that helped people understand why you were asking them to do what they were doing. And so it's kind of a methodology and a process that I've always then used and adopted. And with the different notified bodies that I've worked for, I've also kind of shared that experience with them.
It sounds like you've got a lot to thank that recruiter for. Which, there
Yes.
you go. There's the soundbite. But beyond these happy accidents, which have kind of guided you to your early points in your career, is there a key defining moment or experience in your life that changed everything for you?
I think it's kind of that realization sometimes that you can actually do this. That it's not something that it's something that it's not necessarily that lightning bolt moment.
Yeah.
It's that sudden feeling, this is my world, these are my people.
Mm-hmm.
I feel comfortable in this world, and actually I'm doing something that makes a difference. That when people actually kind of come back to you and you can see that, as a notified body, you weren't helping people like I do as a consultant, but still on the other hand, seeing those certificates come out the other end and knowing that the devices that you've approved are now helping patients is really, really important.
I think we're seeing, like, our experience and knowledge of you in the industry is the past 10 years. But if we go back to when you were entering into the notified body space, that feeling of I can do this, was there much imposter syndrome in those early
Oh,
days?
Steve Lee from ABHI said to me the other day, "What, you have imposter syndrome?" I said, "Oh, yeah, big style." Every time I go to a conference, I think, why do people want to listen to me? Um, and sometimes it is now, having been round the block so many times, that it's a case of we often have the same discussions. And again, we're now in a point when the regulations that, I've been in the industry, 38 years, probably 28 of those have actually been within the regulatory sphere in one way or another. And we've been in transition the whole time.
Yeah.
So sometimes I get Groundhog Day, like, oh, I've been here before. But on the other hand, I think culture, the way people react, the way you need to position things that people actually understand, why you're asking for certain things, that's actually part of the package. Sometimes it's really simple things. We've got the change to the UK regulations that are going on at the moment, and trying to explain to the regulators that, yeah, you want to add this little sentence to the labelling or the instructions for use. Do you realise that the impact it has on all rest of world labelling and the huge unintended consequences of some of the things you're asking? Those are things that in the early days we'd have probably just had to suck it up. Whereas now we can see that they don't understand and they don't know, and that we need to kind of gently pave the way. It's not they're stupid, it's not we're stupid. It's just communication and making sure that everyone can sympathise, empathise with each other's positions. And so that's kind of being the old lady of the IVD regulation. It's kind of nice to be able to kind of share some of that experience, perhaps in a more proactive, positive way. Whereas, otherwise you can end up kind of moaning and groaning about what's been put upon you. Whereas kind of, it's also influencing as well.
Yeah. And I guess now, working as an independent consultant with the experience that you've got, it's probably a different proposition for you. You get paid to say what is required, whether people listen to you or not. It's their prerogative.
I did start this by saying I'm a Yorkshire lass. So, yeah, I'll tell it how it is. And I think those people who come and want to work with me are sometimes because that's actually what they want me to do. But also sometimes it's talking to C-suite people, because again, it's trying to put it in their terms and their words. So why is this a benefit to me? Or if it's an investor with a startup company, explaining the strategy in words and terms that they will understand and recognize and go, oh, that's why they're doing. Okay, now that makes sense to me. So I kind of sometimes feel that, you talked about imposter syndrome. There are those people who would go, oh, Sue Spencer, regulatory box. But actually, there's a lot of regulatory stuff that other people do that I don't. If you want to register a product in Azerbaijan, I am not your girl. So sometimes it's perhaps that softer skill side that comes with it. And so, yes, I do some strategy work. I'm often doing work supporting the people who are actually in the company to help them communicate upwards. Yeah, you really do need to do this, but this is why. And sometimes I feel sorry for those people, because like, why aren't you listening to me? I'm telling you the same story. And sometimes it's a kind of helping them, how to communicate that.
Yeah, and a lot of the consultants that we work with, the best ones, they're almost like coaches,
Yeah.
and it takes a certain amount of years in the industry and experiences to get to that point, 'cause it's just your credibility then. But that experience usually comes when things don't go right, and that's when you build resilience to certain situations. So perhaps during your notified body days or what you were doing through the COVID period, which was difficult for the entire industry. I think it was just such an unknown. Were there any stories that you could share that maybe led to personal growth or a test of your resilience where there may be some lessons for the listeners?
Yes. So I'm going to mention the B word, Brexit. So, I mean, the Queen once said she had an annus horribilis. Well, I had one of those. So at the time I was working for UL. So UL was a UK-based notified body who also purchased Emergo, who was a consultancy. So I had a horrible situation where we were having to basically move out of move manufacturers to other notified bodies. So that would mean they were going to have to change all their labelling. So there was a lot of very unhappy customers. Unfortunately, at the same time, I also lost my father. So it was a very tough year. And it was also at the same time as both my sons went to university. I'd been a single parent for 20 years. And so I kind of was basically home alone, mad old lady with cats, and with this huge pressure of trying to sort out. Because at the end of the day, you had to bear in mind that these manufacturers were having to transfer to other notified bodies. They were patients on the receiving end of those devices. So it had to be done in the smoothest way possible. And I had to do a lot of work with MHRA to kind of keep the wheels on the wagon. So I actually joined a rock choir.
Nice.
So it's a contemporary choir, 35,000 members throughout the UK. But it meant that one evening a week, I did not think about work. And the other thing is giving back as well. So we perform on a regular basis and raise a lot of money for charity. I mean, it's not uncommon for us to be singing on a Saturday and raise £1,000 for the local hospice or one of the local children's charities. So you kind of, it's that being completely out of your workspace, doing something to give back to the community. But at the same time, the reason I really joined was to build a larger friendship group, because I was lucky enough after that to meet my lovely husband, who I'm now married to. But this was just slightly before that. And, having people who you don't want to talk about work issues, but perhaps know you're having a tough time.
Yeah.
And you can talk to about that. And also you can support them as well. And so I've got a very good support network. I was lucky enough as my children grew up, to have a good support network, often by other single mums who we would help and share childcare activities with each other. Fantastic childminder. But having that friendship group, moving, I think I can kind of see that moving forwards to sort of into my retirement as well. So it's people of different age groups, different backgrounds. Something common to talk about that is not work is actually really, really key. And, they always say, behind every successful man, there's a woman. Well, actually behind, they say it takes a village to raise a child. And it's kind of that you've got to kind of find your people.
Mm-hmm. Yeah.
And whether it be, gentlemen going to men in sheds organisations, or there's a lot of ladies. I think choirs are sometimes even prescribed by doctors. It's really, really key to have me time. And you could think of me time as kind of sitting in a bath with candles and or a spa day or whatever, but actually meeting people and doing something that helps somebody else, to me that's really, really important.
And sort of during this time, sort of COVID, Brexit, lost a parent, your children are growing up and moving out, that's going to take its toll on you, on anyone. And I suppose what was your emotional well-being like at that time? How were you feeling?
Knackered. One of my friends and colleagues said to me, "Sue, how on earth do you cope?" I said, you look forward, not down. And I've kind of always gone on those times of really high level of stress. You have your list of things, you prioritize it, you recognize you can only do the top three, and you have to forgive yourself for the other, was it seven underneath that? But sometimes it's kind of forgiving yourself that you can't do everything. You can only do your best. I'm also one of those strange people. I'm really good in a crisis. But when the crisis has gone, and in my case, it was like a year later, it was actually on the anniversary of my dad dying. I was at a meeting in the US. And I just, went to my hotel room and cried for about an hour. And you just have to realize that's normal. And it hits you at different times. But having those people around you to support you and know that that's not weird, and the fact that you can talk about these things to them, again, that's really important. It's not only it's kind of having you have your professional support network, that you need your home support network, and you need kind of perhaps a subset, maybe sometimes of both of those, is your kind of mental health support network. So I'm lucky enough to have, some good work colleagues as well who, you know, they know they can ring me up and go, ah. But also, I know that I can ring them up and just say, I'm having the worst time ever. And, I think that's kind of what keeps you sane.
Yeah. And what advice would you give to the listeners right now that perhaps they're going through their own turning point in their life or a particular challenge? If you had to list off the things that you would do right now, what would it be?
Find something that is your space. It doesn't matter whether it's, okay, I sing and I promise I won't do that here. I have a face for radio. I have a voice for choir. Um, but whether it be, gardening, walking, whatever it is, going to the gym, swimming, find something that kind of, I always kind of think of it as a bit like if you have a bottle of Coke that you've shaken up, you've got to go tss, 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 and let the pressure off gradually so that it doesn't go bang. And find those people. And if you haven't got those people who are going to be there to support you, you need to go and find some. Because no man is an island. You can't do this on your own. And then forgive yourself. And this is one of the things. Some people have been kind enough recently to come up to me at conferences and say, "Oh, you really helped me, out in my career." Whether it was, you did the first training for us. But sometimes it's a case of, I remember my mother always saying, there's never a good time to have children. And I think sometimes as working mums, you have this sort of fear that you are, doing something wrong. But it did make me change career. So, I worked for LRQA. I was made redundant because they relocated up to Coventry. And I deliberately chose to go and work in consultancy at that point because I could get that work-life balance. I could see the kids to school. My childminder was there so I could work, but I could also choose to pick them up from school. I was there at every, assembly and things like that. I was there for the important moments, but you still have this guilt. And I think, I hear this from, ladies who are working, who have young kids. It's kind of like you constantly have this guilt. Am I damaging them? Am I not doing the right thing? And having kind of come through that, I kind of go, my kids still talk to me.
Yeah.
They're not robbing old ladies on street corners. They do have a work ethic. I do say be careful because some of them might end up going into the same industry as you. But it's kind of that when you're through it, it's fine. You kind of want to be able to rewind and say, could I go back to my earlier self and go, don't worry, it'll be okay. And it's kind of like if I'm talking to, younger ladies at conferences, it's like, don't worry, it'll be okay. Just kind of listen to that little voice inside your head. It's actually telling you to do the right thing. And kind of, it'll work itself out. As I say, look ahead, don't look down.
Yeah.
With that example there, when you were going through early stages of motherhood and balancing work, culturally, was the work environment very different to maybe what people see today? And the topic of conversation around work-life balance, parenthood, maternity leave, paternity leave, it is a hot topic. So
It was very, very different. I mean, again, I've always been lucky that I've had supportive managers, etc. But it wasn't something you kind of in the background managed it. Whereas I think now you could be a lot more upfront about it than you used to be. So I know when I've been managing teams, and I know people who've had younger children or in some cases had adopted children, that it's like no, I expect you to go to sports day. So I will be very disappointed if I find that you haven't gone to sports day and we will work around it. But I think it wasn't necessarily that way in the past. I remember doing quite a bit of work in Germany. And one of the ladies saying to me at the time, and this wasn't somebody from Abbott, I hasten to add, that it was considered culturally that only bad mums work, which
wow.
at the time was just like, whoa. And then I looked at the organisation and I thought, oh, yes, there's quite a lot of senior ladies in this, but they're all unmarried without children. And that was really quite sad. And they didn't preface it by saying, obviously, present company accepted. So you just had to take quite a deep swallow and go, okay, cultural difference, I'll note that.
Yeah, yeah. We talk about it a lot about working out what your non-negotiables are. And for a lot of people, when they think about that subject, it's what are your personal non-negotiables, and then how does your work life fit in around that? And if it doesn't, do you need to make some changes? Like you said about moving into consulting when you had young children, that was the right move because clearly your non-negotiables were not missing the important bits. And your non-negotiables can change over time through those experiences. It shapes you as a leader. So what do you think some people would say about you that have reported into you? How would they describe you as a leader?
Oh, that's an interesting one. When I was at BSI, we actually they did a version of Myers-Briggs, where you have the different colours, etc. And when they did the feedback, they said, well, this is really interesting. Everybody in the team has the same profile, with the exception of one person. And I was that person that didn't have the same profile as everybody else. So everybody else was sort of highly detail orientated and kind of real go-getters.
So
Whereas
what's that? Is that blue red? I think that's
yeah,
blue red,
they were
isn't it?
blue red.
Yeah.
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 Whereas I'm over the other side. But I think it's mainly because, the important thing I learned from that was it was what some of the things I was doing that potentially driving them crackers. So my habit at the end of the day would be, oh, right, tomorrow, this is me closing down my brain so I can go to sleep. Is, oh, need to get this done, this done, this done. So I'd sometimes fire off a few emails. Now, I did not expect at 10, 11 o'clock at night for anyone to open it, read it, and do anything about it. What I hadn't realised with those people who were red blue, that they were going to potentially open it and go, oh crap, I need to do this. But it did generate us to have that conversation and go, no, 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 this is Sue's brain dump.
Yeah.
I don't expect you to do that. And also me understanding that they needed more detail information than I would actually need. I think the other thing is trusting the people that work for you and I will try and actively say that I trust you. So otherwise, particularly when you take over a team or to start with, people keep checking back every 5 minutes. Is this okay? Is this okay? And you kind of get to a point where you go, do you think it's okay? Yes. Do you think that I'm going to say something different? No. Okay, I trust you. Just go do it. And particularly at times where I always like the Steve Jobs quotes about you hire clever people to tell you what to do. And
Hmm.
certainly as I've kind of gone through, sort of mid-career onwards, and I'm, running teams and things, it's I fully recognise that, particularly in notified bodies, etc. And also when I was at QServe as well, there's a lot of very smart people who know lots more about things in a lot more detail than I do. I can help them communicate, herd cats, run the business side, do business development. So I have my skill set that brings it together. And as one of my ex-colleagues would say, she says this about herself: I know enough to be dangerous. I know enough to understand what's needed and also what I don't know.
Mm.
And to be honest, coming full circle to where I am now in Compliance Connections, Connections was chosen deliberately because I don't
Hmm.
think everybody knows everything. Um, and I come across consultants in the past that will like to claim, come work with me, I can do everything. No, 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 you can't. And there are times where you need a good phone a friend list, and you need to be honest with that person and say, I'm not the best person for this, go talk to that person. And I think it's really important that you do that to kind of give the best sort of service, I guess, at the end of the day, to the customer. So that's kind of my ethos with in terms of what I'm doing at the moment.
And where do you see yourself going from here then, professionally, personally? You've started this consultancy, which we talk to people almost every day that are at different points in their career looking to make that switch from perm to consulting, and you've done that as of earlier this year. So what does the future outlook look like for you?
So it's not my first rodeo. So I have done consultancy in the past. It is a really, anyone who's thinking about doing it, it is a scary move because particularly at the moment, the consultancy business is unpredictable, as in the whole regulatory landscape we have at the moment is very unpredictable. Um, so um, on the other hand, if you're trying to get work-life balance, now I'm not trying to build a huge consultancy, spoiler alert. um, and I've loved growing teams. I've loved running businesses. I've loved supporting the customers that I've worked with. But kind of now I want to be able to choose the work that I do. So sometimes that may be working for large multinationals, supporting strategy and things like that. But also it might be working with trade associations where I'm kind of giving my time, and it might be working for smaller startups, which perhaps might have something that's an interesting technology or something that actually interests me. So I guess I'm perhaps being a bit spoilt that it allows me to pick and choose and do a variety of things. I've actually done quite a lot of auditing, which I haven't done for a while. Um, and that's nice again because you physically get to interact. I love going around sites. I'm sorry, I'm a complete geek. I really love going into warehouses and manufacturing floors and things like that. I'm quite happy to put a clean room suit on and go into where products actually being made. So it's kind of like going back to your grassroots, going back to the floor,
Mm.
but also being able to share that experience. So not being so much of a one trick pony, because sometimes you find that people will ask you a question, but there is a question they're not asking you.
Mm.
And in fact, actually, that was my day one in consultancy. And I shared an office with Caroline Freeman, who's recently retired. And I remember coming off the phone and saying, they're asking me this and that, but that's not really the right thing. They're not asking me the right question. And she said, you've just learnt your first lesson in consultancy. The customer does not ask the right question. The trick is to get them to ask you the right question or understand the questions they need to ask you. And so that's kind of that skill. It's kind of using that. And sometimes that's a skill that the startup companies need, but it's not quite so easy for the larger companies to deliver because often they may have somebody that does QMS and they have somebody that does regulatory and somebody else. So you don't get the holistic view quite in the same way.
So I feel like, well, during our recruitment career, focusing a lot on quality assurance, regulatory affairs, there's been so many projects and changes, Brexit, COVID, new regulations. I was going to say, what excites you most about the future of this industry? Because there's still so much on the horizon. We're also coming out of a very busy period, but what are you most excited about in this industry?
I'd say a couple of themes. One is I've ended up doing quite a bit of work in the companion diagnostic space over the last couple of years, mainly since the regulation came in, and I think a lot of pharma companies got caught on the hop because the clinical trial part of it kind of kicked in straight away. And but the technology piece behind this, in terms of, cancer is not one disease. It's lots of different. There's lots of mistakes in, mutations, etc. And there are lots of potential drugs that will help those particular patients. You just got to find them. So that's one thing I think is a technologically quite an interesting space to work in. And also, it's a space that needs a lot of education because you have this very strange dynamic that you've got the large pharma companies who don't understand diagnostics and frankly don't want to learn diagnostics. They're often working with small biomarker companies who don't see themselves as IVD companies because they do clinical trial assays. And so you kind of got this gap in the middle. And again, it's a communication gap sometimes that needs to be filled. So in terms of helping us as patients, that's a huge potential advance. But also the wheels haven't quite meshed together yet. Some companies are now starting to, pharma guys hire people who understand diagnostics. There are projects like Combine that are going on that will kind of help bring some of these things together. On the flip side of it, if I go back to my beginning in notified bodies, I remember the days of audit reports being handwritten, which was always entertaining when the competent authority came into audit because having had two parents that were doctors, I was one of the few people who could actually read the audit reports. But then we kind of got to the point there, everything's typed, everything is stored in SharePoint or whatever systems. But now what I'm starting to see as a trend is that smaller manufacturers or medium-sized manufacturers are starting to look at how do we automate our technical files, because there's a lot of repetition in them, for example. And it's not the big guys who are adopting it, because it's kind of takes a long time to change direction of a supertanker. It's actually those, not necessarily startups, but those medium-sized companies that are having a go at doing this at the moment. So, we already know that, FDA, et cetera, is looking at using AI as part of review processes and things like that. So I think that sort of implementation, and you could say me being, the old girl of, the IVD directive shouldn't necessarily be interested or excited at that. That I should be going, oh, that's for the young uns, I'll, retire at this point. But it's still rubbish in, rubbish out. So I think it's a case of trying to use some of the experience that the old lags like myself have, but actually kind of bake that into the system so that, but it will then change perhaps the world of contracting and consultancy because, back in the day, it used to be that, oh yeah, I'll hire this person who'll come in and write my technical file for me. Well, you might need that, but actually perhaps you can, I'm seeing some companies look at perhaps training their design folk to write it and template it in a certain way that allows it to be sucked out and dropped into the technical file. So actually, the skill set you need isn't kind of cannon fodder just to, retype things into a technical file format. It's people that kind of understand how all the pieces fit together, what pieces should be there, and can polish the technical writing. So actually, the skill set changes and is slightly different moving forwards. But ultimately, there's been concern about delays with notified bodies, the volume of information. I think competent authorities need to learn to trust as well, and industry trust notified bodies. I think because of the PIP scandal, etc., a lot of trust has been lost from the system that used to be there when I first came in. So I can see the industry changing and evolving. There's the opportunity for it to evolve in a positive way. And I'd kind of like to see that happen. But it's kind of, the devil is in the detail. So we just have to see how that pans out.
So before we wrap this up, if you had to summarize one lesson from your journey for our listeners, what would you say?
I would probably say sometimes I wished I'd listened to that quiet, sensible voice inside my head and not worried myself too much. So, you got this. Whether it be the kind of work-life balance piece of it or the sometimes when, you're implementing something new, everybody's learning on the job. So you just have to think logically and, do your best. And that's really all you can do. And be transparent. So, there are times where, that could have gone better. So as long as you're transparent about that, you can fix things. So kind of listen to that quiet, still voice in your head is what I would say.
Well, from Duncan and I'd just like to say thank you for joining us today and for sharing your story, for sharing the difficult moments. And I think the listeners will benefit from hearing that Sue Spencer does have doubt, has had moments of
A lot of those.
not really sure what's going to happen. But if you listen to that inner voice that's saying things will be okay, then it will all work its way out. So yeah, big thank you from us.
Yes, thank you very much.
And
I think if
kind of one thing I would say is, you don't always get that chance to say thank you. So if you're one of those people that I've worked with and you're listening to this, thank you.
And for the people that are listening, if this episode has made you reflect on your own turning point or your own challenge in your life and you'd like to sort of come on here and share it, please do reach out. And don't forget to like and subscribe to the channel. And we look forward to bringing you some more fascinating stories from MedTech. Thank you.
Thank you, guys.
Thank you.
nice, thank you.